Hi, my name is Kristi Graziano, and I am the Home and Community-Based Services Program Director at Association for Mental Health and Wellness. I am so proud to announce that we are now providing community psychiatric support and treatment to those members who have active Medicaid and who are HARP enrolled. Our CPST services are designed for those individuals who are struggling with a mental health or substance use diagnoses who have not traditionally responded to traditional site-based treatments. To enroll in our services, please contact your care manager to get started. And if you don't have a care manager or you don't want a care manager, contact our RCA Outreach Department to get started. So today, I am here to introduce you to our CPST team, who are going to be speaking a little bit about what this individualized service is about and how these services are rendered. So, without further ado, please meet our CPST team. Jillian Aiello, LMSW CPST Professional, Kathleen Garneau, CPST LCSW, and Suzanne Kontak, Nurse Practitioner, CPST Medication Management Prescriber. Take it away, Jillian.
Hi, my name is Jillian, and I'm a Community Psychiatric Support and Treatment Clinician with the Association for Mental Health and Wellness. Isn't that a mouthful? So I have this amazing opportunity to work with clients in the community, to really meet them where they're at, and work with clients who, for a variety of reasons, may not have the skills to be able to access traditional forms of community mental health treatment. So I utilize a very collaborative approach. We love to work with people who our clients have identified as supports for them, whether that be friends or family members, other professionals. I also have the opportunity to collaborate very closely with Suzanne, our nurse practitioner, so we can kind of put our heads together with the client and really come up with a good plan to help them meet their needs. In meeting clients where they're at, we do a lot of harm reduction. I also utilize a lot of CBT techniques, identifying and challenging automatic negative thought processes. We do a lot of DBT skill related building, such as with emotional regulation and distress tolerance. And with the HCBS services, we just have this amazing flexibility to work with clients. For example, if a client went into a traditional therapy session, the therapist and the client may talk about coping skills. I have the ability to take that a step further. I have a client who's working on increasing their physical activity as a coping skill to decrease depression and anxiety. So the client and I came up with a plan together. They wanted to utilize a local gym, and we were actually able to meet at the gym together, spend a few minutes, and then actually walk on the treadmill. So what is this coping skill of physical activity? Then we took a few minutes after doing a little workout, and we talked about how does this feel using this coping skill? Could I make this part of my routine? How could this benefit me to deal with my depression and anxiety? So for me, it's very important to work with clients to develop skills. We don't want to have a lifelong client. We want our clients to graduate our program and have the skills available to them and be able to identify, when do I use this skill? How do I use this skill? And I feel that really helps them lead a productive, healthy life that they would like. And with that, I'd like to turn this over to my colleague, Kathy.
Hi, my name is Kathleen Garneau. I am a clinical social worker and registered nurse working in the Home and Community-Based Service Program here at the Association for Mental Health and Wellness. So in my role, I actually wear two hats. So I'll address my first hat first. That is the role of a clinical social worker, where I am charged with completing assessments and doing in-home visits for individuals for therapy. So what does that look like? Well, during our non-COVID days, That would have me going into the client's home where they feel comfortable and have not really, taken well or succeeded in office or on-site therapeutic sessions. It also gives an opportunity to see how folks actually live and respond in their own environment. And then we can set out and put a plan in place with a therapeutic modality that works best for them, which in most cases is grounded in CBT, cognitive behavioral therapy. This gives folks the opportunity to look at how they view the world and hopefully to change some behaviors that are impacting the quality of their life. And now with the COVID-19 restrictions, we have been doing this via Zoom and by telephone. Some clients like the Zoom, which has been very successful, but others who prefer to stay off camera and, conduct the classes or the sessions, by phone. That too I've been finding to be as successful. So far so good, and we'll see what the future brings as far as, where we go with the COVID-19 restrictions going forward. So that brings me to my second hat, and that is the hat of my hat as a registered nurse. So in that realm, I collaborate with our psychiatric nurse practitioner, our program director, another HCBS clinical provider, Jillian Aiello, who you will have heard from earlier. And in that role, I try to put together a picture of what the client's needs are so that they can receive the best services possible. So with that said, I am delighted to turn it over to my colleague and our psychiatric nurse practitioner, Suzanne Kontak.
Hi, my name is Suzanne Kontak. I'm a psychiatric and adult health nurse practitioner for the Home and Community-Based Services Program at the Association for Mental Health and Wellness. My role in the program is to provide psychiatric care that includes psychiatric evaluation, diagnosis, and management. One of the things that I think is very special about the program is, in addition to evaluating the client's mental health and well-being, we place a large focus on health assessment of the client to see if there's any unmet needs that the client may have that can be having a significant impact on their mental health and well-being. A short example of this would be a patient who may be suffering chronic pain from a headache condition or fibromyalgia or a car accident, and when they come for mental health care, their other illnesses can play a large role in their mental health and well-being if these needs are not being addressed. We are a multidisciplinary team, and we closely collaborate on the client to help the client achieve optimal outcomes. I really believe in this program,